Hi, my name is Mariana, and today we're going to be discussing Autism Spectrum Disorder. This is an overview of what we're going to be touching on today. So firstly, let's talk about Autism Spectrum Disorder more generally. What is it, who does it affect, and how prevalent is it? Autism spectrum disorder is a neurodevelopmental disorder characterized by certain behavioral deficits, including marked impairment in communication, social skills, and cognition. It begins prenatally and is associated with morphological abnormalities and changes in functioning of the developing brain. According to epidemiological studies, it is estimated that 1 in 70 Australians are on the autism spectrum, amounting to a 40% increase in prevalence rates. However, it's important to note that this increase is likely a reflection of the fact that we are getting better at recognising and diagnosing autism in people of all ages, and we have seen greater advancements in research and our understanding as a community. Now let's look at some of the clinical criteria used to diagnose autism spectrum disorder. As there are no reliable biomarkers, a diagnosis is typically made on the basis of behaviour. To meet the clinical criteria, according to the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, also known as DSM-5, on a single spectrum, a child must have both of the following: A, persistent deficits in social communication and social interaction, and B, restricted repetitive patterns of behaviour, interests, or activities. The effects of this disorder and the severity of symptoms vary greatly between individuals as it is a highly heterogeneous disorder, with severity levels ranging from level 1 being requiring support to level 3, which is requiring very substantial support. Now let's have a look at the neurobiological features characteristic to this disorder. According to several studies, marked deficits in social communication and interaction, coupled with the repetitive stereotype behaviour seen in people with autism, are indicative of abnormalities in neuroanatomic structures and neurodevelopmental pathways that may have been implicated during intrauterine and/or early postnatal brain development. The structural morphological brain abnormalities in autism include altered brain growth, which is more specifically a pattern of brain overgrowth that has been observed during 2 neurodevelopmental phases. The first being a reduced head size at birth, followed by a sudden and excessive increase between 1 to 2 months. This abnormality has been observed in areas of the frontal lobe, cerebellum, and limbic structures, which are regions involved in the development of social communication and motor abilities. Furthermore, neuroimaging studies have also shown enlargements in the cerebral cortex, amygdala, and hippocampus. Another abnormality seen is neuronal and cortical disorganization, which manifests as cytoarchitectural organizational abnormalities in brain structures including the cerebral cortex, cerebellum, and other subcortical structures. Connectivity between brain regions has also seen to be disrupted, with several fMRI images of the brain conveying abnormal patterns of activation and synchronization across different cortical and subcortical regions, in addition to the disruption of white matter tracts involved in social function. Lastly, synaptic and dendritic changes have been observed, which clinically manifest as abnormalities in the synaptic pathways and dendrites. The abnormalities just mentioned result in impairment in social cognition and interaction, language and communication, and motor development deficits. Let's move on to treatment options available. The treatment options available are based on the early intervention and management of symptoms, whereby language and social skills are taught through needs-based educational programs and behavioural therapies, such as speech pathology, where the focus is largely the development of communication and social skills, and occupational therapy, where the focus is placed on sensory motor development, such as learning play and fine motor skills, as well as coping mechanisms for various social situations. Finally, let's discuss future developments. Future developments include identifying specific causal elements of autism, the potential discovery of biology-based treatments, and the adoption of evidence-based interventions. So to wrap up what we've learnt today, autism spectrum disorder is a neurodevelopmental disorder affecting 1 in 70 Australians. The neurobiology behind it involves abnormalities in brain growth, neuronal and cortical organisation, connectivity between brain regions and disruption of white matter tracts, and synaptic pathways and dendrites. A diagnosis is made on the basis of behaviour, which must satisfy 2 essential criterion, and the treatment options available involved needs-based educational programs and behavioural therapies.